Hello everyone, and hope you're having a good day. So right now is March 10th, almost midnight, but it's March 11th now, just past midnight. But it is daylight saving time, so that's been a topic of discussion lately, and people are against it basically. And the idea is that why not just have daylight saving time year round? Well, why not just have regular time and then just reschedule your times? You can just get up earlier to go to work. People can adjust, right? So instead of 9 to 5, everybody get up from 8 to I don't know 4. Anyway, so that's just my take. It doesn't make sense. I mean, politicians debate the most ridiculous things, and I don't know. Anyway, even a politician like Andrew Yang, who likes math, are in it. I don't know. Okay, that's just a rant. But following this is an apology that I've noticed that lately my audio has been horrible because there's like a high hissing sound in the back. So I reconnected everything. Hopefully it's working better now. So, well, we'll see. If you're listening to me fine, that's good. So today's topic, we keep talking about this pandemic. It's not named a pandemic because the World Health Organization received $20 million from the China government. And based on that, the Chinese government doesn't want them to call it a pandemic, so that, would affect the economy of China. So hence, they're not calling it. But we all know what it is, and they just don't want to call it what it is. So today I want to talk about incubation. What is incubation and what does it mean? So basically, this virus that we're facing is vastly different from everything else we have encountered. And the key thing is that it has a really long incubation period. And during that period, if you're sick, you may not show any sign at all that you're sick. Yet still, you have the potential to pass the virus on. So the virus is already multiplying inside your body without giving you symptoms. Yet, you can still cough it out and then pass it on to somebody else. But nobody would know. So that's the real danger for this virus. Plus the fact that it's new to human body and we don't have any sort of immune system response. Nobody has it, so it's a new virus. Plus the fact that it is quite deadly compared to the common flu. How deadly it is still up for debate. Nobody has a certain, because we're in the middle of it, nobody's certain with it. I did bring up the death rate, how the public view it through the announcements from scientists saying that it's only a few percent. They're not wrong, but the things that the public doesn't understand, I brought it up in the other video. Go back and look at it. It's called death rate. The public doesn't understand what case fatality is, what that means. It's simple. It's case fatality is how many people died outside of how many people who got this disease. However, that's not an accurate assessment of their danger. It's way undervaluing their potential danger, because if you think about it, the people who's got it, they're still struggling through with this virus. Some people may still die. So, we don't know. Just because they contracted and they haven't died, it doesn't mean that it's not dangerous. They're out of it just because as soon as somebody died, we can start counting. No, the second person may die, the third person. That's what happens until all these sick people get recovered. Then can we say, okay, what is the actual fatality rate? That's how the public sort of perceive this. Experts understand this, understand what the term means, but the public doesn't. They think, okay, if it's only 1%, we'll live with it, and then hope for the best. Just protect our elderly, and we should be fine. That's not how it works. Okay, so I'm not blaming the scientific community. What I'm saying is that basically the public lacks the fundamental tools to get into this. I might be worrying too much. Maybe all of you understand what it is, perfectly fine. But I think it's worth to bring it up, and I'm pretty sure some people wouldn't understand. I know, plenty of people in my family doesn't understand the difference, and maybe I'm over worrying because they don't even care. They're either scared or they are, just or they don't know what the implications are. They don't really want to find out. So that's what I'm trying to deal with. Anyway. and trying to help everybody to understand the situation. And it doesn't take a whole lot. It just takes, you just sit down and look at things. And I've seen plenty of videos of experts, shows, TV shows, medias. There's standard practice. Get somebody to start talking. Get an expert. So this is a Joe Rogan experience, the famous podcast. And he brought up, wow, this is controversial. This expert, Michael Osterholm. Basically, he's saying the same thing I was saying. And he's saying that close to 100 million people would have problems, would get this disease. And then, a certain number need to, close to, I forgot, just watch it. It was published in some study, some publication. Actually, my estimation is even higher than his. I mean, but we're really close. By the time we get to that point, the society it's pretty bad. It's just futile, okay, to try to fight it. So all we're trying to do is to get the public to be aware, not so that we don't have to get into that panic mode and, get into that, hopeless mode that China had gone through, Wuhan had gone through, and a lot of people died for that. And then right now, Italy, Milan is going through that. So that's the whole point. We don't want to do it. There are ways to do it. Just watch his podcast, telling everybody what is likely to happen. Doesn't mean that it's going to happen. Telling everybody if we don't do anything about it, it's going to happen that way. You don't have to believe us. But, why do we want to gamble? There are things we can do to prevent that, to be much, much better off. Everybody's going to be better off. Economy is going to be better off. Our lifestyle is going to be better off. We're going to be richer, or we're going to be less poor than if we didn't do anything, even if we didn't, practice prudent measures. So now, I don't know about everybody else, but I'm going to pull my children out of the school and just keep them home from now on. It's March 11th. So that's my decision. Anyway, let's go back to the incubation period. So what makes this virus and this disease especially hard to combat. So the draconian measures that the Chinese government took actually worked, because you have to limit people's mobility, people's association, the social situation, social distancing that we need to impose. Okay, why do we have like a 14-day period to do that? Because by observation that people sort of have the problem manifest itself in about 5 days on average. Okay, that's the most common. Some may happen earlier, 3 days, 2 days. Some may happen right away, and some may drag it on. So how does it work? It's actually very well understood, this thing. So that's why they come up with a 14-day quarantine period. So the probabilities of things happening is actually very much resembling to a mathematical model that this guy came up with. We call it the Poisson. Poisson is a French guy, distribution. So he's a mathematician that did a lot of work, but this is one thing that he found out, or he set up. I had a graph here, so basically things happen in this way, right? So if you're contracted, it's likely that you don't have any symptom right away, or very few people, and then more people start having some symptoms. Let's say 100 people started out with this, okay? Maybe by the first day, one person have some symptoms. By the second day, a lot more, 5 people. By the third day, 10 people. By the fourth day, wow, we'll have maybe 17 people. By the fifth day, we'll have 19 people. And by the sixth day, we're going to be a little bit fewer. So roughly, it follows that kind of pattern. And if you see this curve, right, goes down to about 13th, 14th day, and then it dies out. So there's a very little chance that, out of 100 people, that somebody's going to have like a 14-day incubation period. So after 14 days, we feel safe. Now, that's a reason to have the 14 days. However, there are cases reporting that some people had a 24-day incubation period in China, and he went to another place. He had his 14 days and went to another place, and then suddenly he's feeling ill. So 24 days. You say, how is that possible? Because we don't have 100 people. If we have 100,000 people, well, let's just say, 10,000 people, right? We'll have to ignore that. So actually, you can see that you're going to have a few people that's going to have their symptoms after 14 days. So maybe a couple on the 15 days and 16 days. So if you're looking at 10,000, right? And some may even, by any chance, although there's a very little chance here, but remember, this is a probability curve, right? It's not like definite, and maybe there's a small chance that somebody has a 24-day. It's very small, but it's possible. If you increase that to 100,000 people, which is what probably China already has, admitted to 80,000. But in fact, maybe they have it even more. Let's say maybe 500,000 people, right? Then you still have most people, happening around 5th day to maybe 8th day. And then you're going to have some people that drag it on to maybe 19, 20 days. And you're going to have, just by chance, you may have one out here. I've heard that there's a 24-day guy and then there's a 42-day guy. But we don't know. Maybe there's some other things that's going on that we don't understand. But just by guessing, most of the people should be okay within 14-day period. So, not guessing, but by sort of experience. So that's how science works. Actually, it's pretty good. 14-day isolation period or quarantine period that you observe yourself and keep your contact to other people minimal. If you even suspect you've been contracted with this disease. So Ted Cruz is doing it. A few members of Congress are doing it. So because they meet a lot of people, and later on they find one of the people that they met is identified. Then they say, okay, I better isolate myself. That's a responsible thing to do. So we all need to take that practice. Again, the trouble right now is that we don't have enough testing kits. Okay, that's the thing, and we don't have enough administer of the testing kits. So I haven't checked in like 3 days or 4 days, but I suspect that if I went back to my children's doctors or its clinic, they're still going to tell me the same thing. They can't do the test, and they don't know who can. We have to go to the hospital and risk getting cross contamination, cross infection. So not a good situation. They should have better information. Maybe I haven't looked. If you understand, especially you should share that information with your friends. Say if you suspect you have some symptoms, you need to go. You need to go check it out and get tested. I think it's covered by most insurance, and hey, it's something we need to do. Okay, I learned another thing from my daughter. She's great. She gets her information from different sources. She doesn't like she respects my videos, but she's a little too young to want to sit through everything. So by the way, if you're listening for this long, thanks for putting up with me. I'm rambling a lot. There's a lot of things going on. So she got this information, I think, from Japan, that it's a really good idea. You can self-examine yourself if you have some sort of lung problem, okay? If you have coughs and all that, if you don't have symptoms, every day after you wake up, what you need to do is you need to take a deep breath and then try to hold it in for maybe 10, 20 seconds. I don't know, if you're a swimmer, you can probably hold it for a minute, but just hold it in for maybe as long as you can and just feel it. See if you feel anything horrible, like if you want to cough, if you cannot hold it for that long, so you usually can hold it for 20 seconds, and then after like 5-6 seconds, you start wanting to cough, you start feeling like really pain in your chest, then maybe you want to go get yourself checked, right? Maybe there's something wrong with your lungs. So that's one way. I think it's a really good idea, because we don't know. Sometimes I have like sore throat, and it's very very easy to get those. But if you cannot hold your breath for too long, that means there's something wrong with your lungs, and usually that's a bad sign. So if that happens and you don't feel well, don't wait for a fever to hit. Just go check it out. Go get tested. Okay. All right. So another piece of bad news. Finally, the U.S. broke 1,000 identified, and that's just past few days. We went jump from like maybe 80, suddenly to 1,000. We're beating the growth curve. That was largely expected because we didn't have enough testing kits, and then we just have a lot more cases that are showing up right now. I guess there's an initial transmission period, and then there's a after incubation period, like maybe 5 days, we're showing a lot more people showing up with symptoms and getting tested. And now the test kits are out. They are. Oh, look at Hawaii. Still a couple confirmed cases over there. So people are getting confirmed because of the test kits are out in the local area. So I expect that this number to jump, continue by the end of the week. Maybe we'll see 2,000. Very, very possible. Okay. So right now, according to this guy, by the way, you should go watch him. He's saying almost exactly the same thing that I'm saying. Okay, he said, largely, well, except for the MasterCard, but yeah, just go watch him. He's saying that every 4 days the number will double. Today's what, Tuesday now? By Friday, so it's gonna be 4 days. End of Friday, probably gonna double, 2,000, maybe even more. All right, and this is like just adding numbers together. So whoever is collecting this data is doing a good job, or else we're really just flying blind. Okay. Alrighty, so have a good day. I don't know, just try to get your children out of school or something. That's what I'm doing. All right.